Now that we've resolved our technical difficulties, thank you to the IT department and to our awesome TV studio. Meeting called to order at 9:15. Okay, we're going to find out what that was about. You have, the open meeting laws were met, requirements were met, the meeting was posted, and my computer reset, and so I have to go back to my agenda. Okay, there we go. We have an agenda. I'm looking for a motion for action on the agenda.
I'll make a motion.
So moved.
Okay, we have a motion by Krista. Do we have a second by Deb?
Yes, ma'am.
Okay. Any discussion, additions, changes anybody wants to make? Okay, all those in favor of approving the agenda say aye. Aye.
Aye.
Those opposed? Okay, the agenda is adopted. We had sent out meeting minutes a little while ago, and so, if you've had a chance to review them, I am looking for a motion for action on the meeting minutes.
Move to approve.
Okay, motion by Rick. I need a second.
I'll second.
Okay, Krista, second. Any discussion, amendments, changes, corrections? Didn't think so, because Sam takes awesome minutes. All those in favor of approving the minutes, say aye. Aye.
Aye.
Those opposed? Okay, minutes are approved. Okay, public health update. We have now, that's going to be representing the health department, Gabrielle, but she goes by Bree. So, do you have the update for us?
Yeah, so currently our case we went 13 days without a single new positive, which is pretty exciting, but then on Tuesday we had our first new one, and we had one yesterday as well. We're up to 4 active cases, which is actually the lowest that we've been in quite a while. We are unfortunately up to 44 deaths. We had a new one reported this week. Our total positives for this entire pandemic is 3,580. And then a brief vaccine update. They gave some Pfizer vaccines out the annex on Wednesday. I don't know how many exactly were given, but they're doing more kind of a pop-up clinic versus mass clinics with the certain doses, and there was a press release that went out, I believe 2 weeks ago, that had those hours on how people can sign up, and all that information is still on our website. And then according to DHS yesterday, 51.5% of Trempealeau County has received at least 1 dose, and 47.2% have completed the series, which is pretty exciting.
Barb had sent something to me that I wanted to share. She mentioned that the, okay, now I have to go find that email. Okay, just give me a moment, please. It had to do with changes in the, let's see, what did she say? That there was going to be a earlier hour set up on a certain day for people who couldn't come in, like during, like the regular clinic hours were out, like not convenient for them, or they couldn't do to work schedules. Mm-hmm. I can't find that email from her right now, but do you know what that is?
I don't have the exact dates. It was on our last press release and it's on our website. But since the hospitals and clinics in the area, Tri-County is still doing vaccinations, and Mayo and Arcadia are doing vaccinations during business hours primarily. Since we don't have a lot of uptake right now and not as many people interested in the vaccine as previously, the health department's offering earlier hours and later hours outside of those business hours to try to get more people to get vaccinated and work with the majority of individual schedules.
Okay. I think the thought that had, some conversations have been had, I think the thought was that if we could get that out to like county employees who may not realize that they should know that they can get vaccinated and then use their COVID time, right? Yeah, they should know, but let them know these hours if there's some reason. We have no way of knowing how many, what percentage of the employees are vaccinated, nor do we need to know, but I had one employee, and had said that to me. I said, no, I think you're supposed to be able to do it on your regular hours, so, okay. Then, anything
Well,
else?
HR, I know, HR sent out an email about that a while ago that you can use HR time, I'm pretty sure, or use COVID time, so I'm pretty sure that's been sent out to staff.
Okay. All right, then, yeah, and I don't know, the employee that called was just basically, you know, just, they were unsure, and so I encouraged them to refer them to HR, to their department head, but anything else that, okay, so,
Not at this time.
so 13 days with no new positives, now we've had an additional, so like one, two, how many?
We had 2 this week so far.
2 this week?
Yep.
Okay. All right. All right. Does anybody have any questions for her? Nope. Okay. Then moving on to the next item. Thank you, Bree. We have discussion action relating to the disaster-related emergency funding sources available to the county. Deb, you usually have the good information on this.
Yes, but today I don't. Today, I don't really have any updates. I know the plan is that for the ARPA funds, the eligible to the county, that Paul is working on that. And what he's going to do is he's going to determine, there's a formula that the Wisconsin Counties Association's put together. He's going to determine what the reduction in revenues was, and then we can apply that going forward for 21, 22, 23, and 24. So we might not get all those funds by the end of the year, but the county would get all those funds. They would go into the general fund, and then at that point, the county can decide how they want to use those funds. There are additional ARPA funds for rental assistance and some utilities, some things like that. We'll be talking with Integrity about that coming up in the next week or two. And then there's other ARPA funds that are coming through the state through different means. For example, I know there's ARPA funds for home delivered meals, and we're being notified through our state agency where we get funding for home delivered meals. So I suspect, like for economic development and some of those, they may be contacted by their state agencies. We continue to have the FEMA option open. It was submitted. We have not heard anything about what was received. We did finally, there's a lot of paperwork to get the FEMA one in, so we finally got our first FEMA one in. So I haven't heard any more on that either. So that's all I have.
Okay, thank you. Does anybody have any questions? I mean, a million, but, okay. Then moving on, number 7, discussion action on availability of PPE. We had told Jeremy that, you know, since the numbers pretty much are where they are, and he's keeping the inventory at the level that we had established as a committee was comfortable for us, which was we'd have at least 3 months supply of what we needed at all times. Barb had said that the health department has like 8,000 masks and then more.
There's a lot of disposable masks in the health department that if anybody needs, reach out to Barb.
Okay, so we have ample supply, and apparently this time, nobody is experiencing shortages. If they have to order, there's no backlogs. It seems to be in abundance now, so. Anybody have any questions on that discussion? Okay, then we'll move on to number 8, discussion, review, action on new and existing COVID-related county policies. A, which is precautions, preventive measures for county facilities and staff. So the county boardroom is back to the way it used to be. We have the squared off horseshoe, so that'll be fun. Do we have any other things that we need to address in terms of returning to pre-COVID status, protocols, et cetera? Okay. They can still hear me, right? Yep, okay. Then, any other COVID topics for future meetings?
I would say in light of the current numbers and with it being summer, because it spreads differently in the summer, maybe we could just meet monthly for the next couple months.
I think
I don't mind
that's,
that.
yeah, I was actually wondering about that myself this morning, if we couldn't just move to a monthly at this point, just because, yeah, things are pretty static. We're not seeing much shift either way. We always have the ability to call meetings as we need to. This is a committee that is driven by the situation, so we have that flexibility. So, is everybody in agreement to moving to just monthly? Feels like it.
Yes.
Yeah, I'm guessing that those that are not present will probably, eagerly agree. So, when do we want to establish? Do we want this on a regular, like the first Friday of every month, the third, the fifth, whatever?
This is the second Friday of the month, and that works pretty well for me. First Friday would not work at all.
Rick, do you
Except
know?
for July- Except for July, the second Friday, it doesn't work now that I say that out loud. I could do 8:30 on the second Friday.
Rick, do you know if the building committee meets on the second Friday of every month, or they just meet as needed?
They just, lately it's been as needed, and so it's not a set schedule.
Okay, because apparently we had a conflict with them this morning, so I just want to be sure that we didn't set it on a time that, if they have a regular time. Okay. Then, any objectors to doing it at the second? Okay. For January, or I'm sorry, for July, Deb, you're saying that 8:30 would work better?
I have another meeting at 9 o'clock that day.
Okay. Is everybody okay with an 8:30 start time on that for July? Okay.
That works.
All right, so let's meet then at 8:30 on the second Friday of July, which is? July 9th. Thank you. Samantha, you got to anticipate this. All right. Is there anything that we want to add to the agenda for next month? Okay.
Nothing comes to mind.
Okay. I try to get the agenda out the month or the week in advance, so, but,
I'd be curious, Sally, in learning about how our vaccination rates are compared to other counties or other states. Like what are we doing right, or what are we not doing right, I guess is kind of what I'd like to learn more about. Maybe that's not in the purview of this committee, but I think that's interesting information.
yeah. I think it's on the agenda for the Board of Health meeting next week.
Possibly. I know all of that information is public on the DHS website. If you go to their COVID data, there's a section for vaccine, and you can hover over each individual county, which is where I pulled the 51.5% of Trempealeau County has received at least one dose, and 47.2% has completed the series. If I remember correctly, when I looked at it this morning, 48.8% of the state of Wisconsin has received at least one dose. And I do know that we're one of the highest vaccine percentages in the western region.
Okay.
That's awesome. Great.
Do we have any idea what percentage of the employees have been vaccinated? I know we can't ask, and we shouldn't, but I don't know if people volunteer that or if we just have a general idea. Okay. Because I'm just curious. Somebody called me and said, well, how do I know if the employees are vaccinated? You don't.
I do know our ADRC is tracking how many of individuals over the age of 65 are vaccinated. Again, we continue to be one of the highest in the state, and it's around
Right.
the low 90s, I think. So that's pretty good too.
Yeah, also on the DHS website where you can see the percentage in each county. If you click on the county specifically, it gives you an age breakdown in certain categories. 65 plus is one of those categories to get those exact numbers.
Yeah, I know that, we've got a good rate on that, so. Okay, then, if there's nothing else for this committee, then I'll go ahead and adjourn the meeting at 9:29, and we will see everybody at 8:30 on July 9th.